Hi, I'm Lindsay. I'm a plastic surgeon, and I put out my newsletter today, and we talked about the 5 critical components of a skincare routine that is effective. And so I wanted to tell you what those 5 critical components are. The first one is a good cleanser. I use the Ulta MD cleanser. This is great for most skin types. I have oily skin, reactive skin, and very sensitive skin. And this cleanser is great. I use it morning and night. The second component is a good antioxidant. This translates to vitamin C. You can add others in, but vitamin C is probably the most important, well studied, and there are some really great options out there. For my patients, I usually tell you to use one of 2 products formulated by SkinCeuticals. It's just my favorite. There's one that's great for dry skin. It's the CE Ferulic. And then there is one that's great for oily skin like me and reactive skin, and that one's called Floritin F. These are great products for decreasing pigmentation and increasing the texture of your skin, and it helps to restore the things that you lose when you age. The third component is sunblock. I love to combine skincare so that I can get different things out of the same product. My favorite SPF is Ulta MD Tinted because I get the hyaluronic acid moisturizing effect from it. I get the tinted aspect of it. It's what I'm wearing now. I do have a little bronzer on over it, but that's all of the skin, like makeup that I have on my face. And it has the SPF, so it's great. It's a moisturizer SPF, and it's tinted and makes your skin glow a little bit. The fourth component is a good retinol product. You can go heavy and do a prescription full strength, which will always have the most effective results, but it does tend to dry you out. It's a little bit harder on the skin. If you have dry, red, flaky skin, you're gonna have a hard time with this. And so you can also buy retinol containing products. So medical grade skincare, super important to get that. The ones at the drugstore don't have enough retinol in them. And side note on this, if you're trying to conceive or pregnant, best not use retinol because it can cause birth defects. So anybody who is not one of those 2 things and is over the age of 30 should definitely be on a retinol, tretinoic acid, retin-A, you'll hear all those terms thrown around, but a vitamin A derivative. And then the last component of an effective skincare routine is a pigment reducer. So my choice for this is a hydroquinone cream prescription that your doctor can prescribe for you. And you put this on to help decrease age spots, sunspots, and even out the pigment in your face. There are medical grade skincare products that have this component in them, but I prefer the prescription. It's easy to use, and I tend to use it more in summer months and after I've had sun exposure in the fall. I use it pretty religiously in the fall to help me kind of work on everything that I built up over the summer when I was sun exposed. Those are the 5 critical components of an effective skincare routine. There's so many other things that you can add or tweak, and I encourage you to play around with it, find the products that you love that work for you, and subscribe to my newsletter to read all about it and understand the full process of aging skin and how to choose a skincare routine for you.